Hello. Today we want to present our person in public health history on Dr. Helen Mary Mayo. My name is Tandon Win. My partner is Leisha Kamojo. Just a quick background on Dr. Helen. She was born on October 1st, 1878 in Adelaide, Australia, was the eldest daughter of a family of seven siblings. She was born to the parents of George Gibbles Mayo. He was initially a draughtsman turned civil engineer, and his wife, Henrietta Mary. Early on in her life, she was enriched with early education. She was taught at home by tutors, such as with the subjects of physics. She later attended the advanced schools for girls, furthering her education with enrolling in the University of Adelaide. Initially, her father was against her studying medicine, thinking that she was actually too young for it. So her first 2 years at university was actually with the arts department. After terrible consideration, she realized that medicine was her path and she switched majors. Her most well-known medical works was co-founding the School for Mothers in 1909, which allows mothers and upcoming mothers to receive education on infant health and care. She also helped founded the Marybia Hospital for Infants, and she also served as the university counselor from 1914 to 1960 at the University of Adelaide. Just a couple historical contributions. She was the first woman to serve on a university council in Australia, which would be the University of Adelaide from 1914 to 1960. She helped establish St. Ames University College for Women, providing more women access to higher education. She was also the key role member in healthcare by being a member of the British Medical Association and a founding fellow of the Royal Australian College of Physicians. He served 20 years on South Australia State Advisory Committee for Health, improving public health policies. He also paved the way for women in leadership roles, education opportunities, healthcare jobs, creating long-lasting social change. A couple influence she had in the public health. Um, During the early 1900s, South Australia was actually facing a irregular mortality rate for infants. However, during the early 1900s, with the guidance of Dr. Helen and many other physicians, he helped reduce infant mortality rates by 60% in South Australia across 4 decades. During the First World War, he actually gathered many doctors in a meeting, hoping to open an infant ward. However, with a lot of protests against her peers, he opened a small hospital for babies, which initially was called St. Peter, what, but was later acquired by the government, renaming to Maryville Hospital in South Australia. In 1909, he proposed a paper on infant mortality to call for early registration of birth and advocated against relying on maternal instincts rather than educating women for motherhood. Um, Early on, she opened a small clinic that was actually inside a kindergarten. She attended it and advised mothers, which later became the School for Mothers Institute and Baby Health Center, which serves mothers in the city and anywhere near the city. Later on, this school became the Mothers and Baby Health Association. Initially, now a small clinic where she served women in the area and the city, which now serve actually the entirety of the whole state.
Moving on to the social determinants of health, Dr. Ellen Mayo did play a significant role in health equity by focusing a lot on maternal and infant health. Particularly, she did address high infant mortality rates and, in the early 20th century in Australia, where she was from. But a lot of her work targeted vulnerable populations, specifically mothers and babies from lower socioeconomic backgrounds, and who lacked access to proper healthcare education. And a lot of her work did establish the Adelaide School for Mothers, which was later on called the Mothers and Babies Health Association. But with that, she provided a lot of vital healthcare and education that ensured that all mothers, regardless of class or, anyone, um, they could go and learn how to care for infants, and that would reduce mortality rates. And that was a critical step towards achieving equity in healthcare for women and children. But regarding the social determinants of health, one of them was health education. So just how I said, that ensured mothers knew how to properly care for their babies, which was nutrition, hygiene, breastfeeding. Another one could be access to healthcare. a lot of established the Mariba Babies Hospital. So that increased access to healthcare for infants, specifically those who were previously not admitted to general hospitals due to infection risks. Lastly, we do have public health policy. Her advocacy pressured the Central Board of Health to reform laws concerning mothers and babies. So that improved healthcare services for, the demographic. And then moving forward, we do have social networks and health plus upstream interventions. There are social networks contributed by her that can be considered a form of intervention in healthcare. In the context of maternal and mental health, like services provided at the Ellen Mayo House, we do have emotional support. So we have family and friends. So in a way, close relationships offer emotional support, which is important for mothers with mental health issues. And family members can come and, provide comfort, encouragement, and help reduce feelings of like isolation. Um, there's also peer support, so connecting with other mothers, you know, groups, therapy, and community programs, which foster a sense of belonging. And, they all share their experience, so they all come together. We do have community and social services, so community-based programs, and we have the mother-infant attachment support. So programs that focus on building healthy relationships between mothers and infants, and that fosters stronger family networks. But lastly, we do also have reducing stigma as an intervention. So public health education and community outreach help to reduce the stigma surrounding maternal mental health. And that encourages women to seek, help. So essentially by creating an environment that supports mental health discussions and, it's an intervention that fosters early diagnosis and treatment, and that improves, the long-term health outcomes. But for the personal connection, Dr. Ellen Mayo's contributions to public health were significant and inspiring, considering how challenging it was to be a woman in regards to the, back then, earliest 20th century and women in medicine. But she did establish the Mothers and Babies Health Association, and as a result, she promoted a lot of maternal education and accessibility to healthcare. Society viewed public health from an entirely new perspective, specifically and especially regarding women and children. And her approach, based on education, preventative care, and early intervention, did demonstrate a lot of, the need for social determinants to be addressed in healthcare. And overall, Dr. Mayo's legacy in public health and women's empowerment did continue to have a profound impact to this day. And these are our references.